Hello, and welcome to the Checkout. I'm Mari Devereaux, Safety and Quality Reporter for Modern Healthcare. The healthcare industry's focus on safety and quality has evolved exponentially over the past 2 decades, with more health systems becoming intent on improving patient outcomes and preventing hospital-acquired conditions. Some organizations and C-suite roles have emerged with the sole purpose of overseeing these efforts. Safety and quality is an area that is closely linked to healthcare leaders' work towards reducing disparities and providing equitable care for patients, part of marginalized communities. As a part of its 2023 Inpatient Prospective Payment System rule, CMS is including new measures to screen for social drivers of health and assess hospitals' commitment to health equity. The agency is hoping to improve hospitals' data collection to better measure and analyze disparities across its quality programs, while also setting an industry-wide standard to consider how care quality could be better for diverse patient populations. Today, I'm excited to be speaking with Dr. Komal Bajaj, New York City Health and Hospitals Chief Quality Officer and newly appointed member of the Agency for Healthcare Research and Quality's National Advisory Council. We'll be talking about ingraining equity into quality efforts and diagnostic safety. Thank you for joining me, Komal.
Thank you, Mari. Great to be here.
You are uniquely positioned as a leader in the safety and quality space, with a background in obstetrics, gynecology, and clinical genetics, and experience working in the Chicagoland area and New York neighborhoods like the Bronx. I want to start by asking you how equity ties into safety and quality work, and how it relates to your position with the Agency for Healthcare Research and Quality.
Yeah, thanks for that, Mari. The other day I was looking through some old files and I found my personal statement from medical school, my application. And like so many other personal statements for folks going into healthcare, my passion for helping people to truly make a difference in people's lives sort of shone through. And my personal statement and the personal statement of so many others around me didn't say we wanted to help only a specific type of person or people. And yet, while equity has been a stated goal for a very long time, it's clear that some of our structures, our processes, and biases really impact healthcare so that, certain groups experience differences in access, in prevention, in outcomes, and we really can and must do better. The Institute for Healthcare Improvement surveyed a bunch of healthcare leaders in July of 2021. And overwhelmingly, the sentiment was that there cannot be any progress in healthcare quality unless there's progress in health equity. And so if we really think about, when I think about healthcare equity, I think about, this notion that everyone can live their healthiest life, no matter who they are, where they are, how much they make, what language they speak, and the color of their skin. And so inherently, they're really, you can't consider healthcare to be high quality unless it is equitable. As it relates to your question about the Agency for Healthcare Research and Quality, or the AHRQ, the AHRQ's mission is to produce evidence related to, sort of high quality care, making healthcare safer. And going one step further, sort of make sure that that evidence is understood and translated. And so for me personally, as a healthcare leader, there's been a lot of products that have come from the AHRQ that have been really sort of transformative for my practice. So things like the Team Steps Playbook, the National Healthcare Quality and Disparities Report, which has been published for the last 19 years through the AHRQ, resources that equip patients to get the most out of their interaction, even a question builder, and some new resources related to diagnostic safety, including sort of measurement of diagnostic safety events. And so I think that the AHRQ is really poised to really make an impact on healthcare quality as defined as, inclusive of equitable care.
For sure. And what are some of the biggest safety and quality issues you've noticed throughout your career in your work with communities of color and populations that are medically disadvantaged?
Yeah, it goes back to that notion of health equity, as the condition where sort of everyone can live their healthiest life. And so much of health is impacted what happens outside of our sort of physical or virtual four walls, if you will. And I think, while quality and safety leaders, rightfully so, are focused on things that happen in the care environment, you know, uh, catheter associated urinary tract infections, cancer screenings, falls, etc. What sort of keeps me up and actually keeps me very motivated is, sort of thinking about what happens and how can we impact sort of health across sort of that continuum, recognizing that so much of health happens sort of upstream, and how can we impact things like community safety and housing instability and access to healthy food. Because at the end of the day, right, these are some of the really important components to health. And, I was actually talking to some healthcare leaders internationally recently. And, while their practice settings are very different, the needs of their communities are very different. This sort of sentiment and sort of thinking differently and thinking about the totality of health really sort of shone through.
And what are some of the resources and strategies that are needed to address some of these issues that you've witnessed?
Yeah, there's no single resource or strategy that's really going to result in equitable, sort of health and care. And it's really going to be this wonderful tapestry, filled with a variety of solutions that really place patients and communities at the center, from design to implementation to assessment. And it's a moral imperative for health entities, for payers, for policymakers, to work towards delivering equitable care. And you mentioned some of the levers in your intro. I'm really heartened to see sort of the movement around accreditation, around remuneration, that are really going to sort of accelerate this change. I also think it's crucial to harness our existing quality and safety sort of structures by ingraining equity into those foundational processes that are really sort of a regular part of a health entity's work. And so, I'd like to share some examples from work that we've done at health and hospitals. And it's really driven by folks at all levels, from our systems chief quality officer to the chief quality officers, and other, sort of folks across the organization, as well as our community partners. One core strategy is to really think about, sort of how do our current structures support or hinder the integration of equity into quality and safety processes. So, for example, when thinking about a facility equity, diversity and inclusion committee, and thinking about where does it report, the decision was made to have that entity report into the facility level quality assurance performance improvement committee, sort of signaling the really tight link between the two. And another strategy to really ingrain equity into quality and safety processes is include the patient voice in hiring. So, no key quality and safety role is filled without a patient being part of that interview team. And it's resulted in some really important, fascinating conversations. And I think it signals to our patients and community, as well as to those that are joining our organization, that, the patient voice, the patient perspective is front and center to what we do. Another really, I think, crucial strategy is to apply a proactive equity lens to performance efforts. And what this really means is sort of prioritizing efforts based on sort of identified disparities, or ensuring that there aren't any intervention generated disparities. When we looked at sort of an initial set of completed PI projects across the system, that sort of utilized an equity lens, what we found was is that a fifth, or 20%, there was actually an intervention generated disparity. And what that meant was there were certain groups that didn't experience the gains. So the gains weren't equal across different groups. We wouldn't know it existed if we didn't go looking for it. And it allows us to develop tests of change to really sort of close that gap. And I imagine that as we begin to sort of continue to ingrain equity into quality and safety, that number actually might go up. But what it really does is it allows us to think about, sort of how do we ensure that gains are experienced equally across different groups. We've also worked really hard to ingrain equity into event analysis, and that sort of includes patient grievances as well, by really thinking about how structural bias or injustice contributes to events has really sparked some important conversations and resulted in action. Our event reporting system also includes the opportunity for staff to really share with us their perspectives on bias and injustice. Again, sort of building agency within our teams around equity-related work.
Diagnostic errors are a huge quality and safety issue, and they disproportionately affect the patients of color who are often improperly diagnosed or treated because of medical bias. On the technology side, there has been lots of innovation using artificial intelligence to more accurately diagnose patients. And I was wondering, what are some things that humans, that clinicians can do on their end to reduce diagnostic errors and ensure more equitable care?
Yeah, Mara, you bring up a really important point. The diagnostic process, if we sort of reflect on our own journeys in healthcare, can often be complex, and it usually requires a lot of collaboration, sometimes multiple visits, with multiple different sort of types of healthcare teams or situations. The National Academy of Science, Engineering, and Medicine, defines diagnostic error as a failure to establish an accurate and timely diagnosis, or a failure to communicate that diagnosis or explanation to the patient. And as you said, it's clear that diagnostic safety contributes significantly to quality and can exacerbate healthcare disparities. And as I reflect on my sort of journey as a healthcare leader and my practice as an OBGYN geneticist, I think that individuals can work to identify and mitigate their own bias. I certainly have had some, major aha moments over the course of the last decade. Continue to develop skills around how to communicate uncertainty. Inherently in the diagnostic process, there is some uncertainty, and it's challenging. It's hard to sort of communicate uncertainty sometimes. And I think it's truly important to partner with patients in their diagnostic journey. And again, sort of equitable care requires patients and communities at the center of this work. The Society for Improving Diagnosis in Medicine and the AHRQ have some resources sort of around around this idea of communication and really thinking about the diagnostic journey and partnering with patients. There's examples of, or at organizational levels, how people have been thinking about sort of improved diagnostic safety. There was a recently published Safer DX checklist, which overviews sort of a whole host of actions that, organizations can take, from things like, explicit board commitment to diagnostic safety work, strategies to measure diagnostic safety events, purposeful efforts to build feedback loops and structured handoffs so that it's clear to staff and patients, what are the expectations around sort of the diagnostic process. And I think equally important in this conversation, the human side of change, is really fostering psychological safety and a safety culture so that we can have honest conversations around, sort of diagnostic safety events. Locally, we've been spending a lot of time applying some of the diagnostic safety sort of frameworks and tools that are well developed in other areas into thinking about maternal mortality reduction efforts. And so while we're sort of in the early stages, it's really clear that applying a diagnostic safety lens to obstetric care is going to be one crucial strategy to really address this crisis.
For sure. And, in your new role in AHRQ, what are some things that you're looking forward to or you're hoping to accomplish in the safety and quality realm and in the, equity realm in this role? And how do you plan on moving the needle?
Yeah, I am truly honored to serve on the AHRQ National Advisory Council and assist the secretary as well as the director in sort of really defining the national health services research agenda. I hope to continue to catalyze conversations around ingraining equity into quality and safety, Sort of, and again, going to that, not just theory, but sort of implementation, which is a key component of the AHRQ. I also hope to really spotlight and build agency in a truly precious healthcare workforce, and really consider on how data and analytics need to evolve to sort of meet our current needs.
And with that, Komal, thank you for taking the time to talk with us. We appreciate your insight and expertise on this subject.
Thank you for having me.
And thank you everyone for tuning in to the checkup.